Here we will talk about beta blockers. So before moving on to the questions in the beta blocker section, we should know what it is. So basically, beta blockers are antagonists to beta mediated effects. It is beta blockers, so they are antagonists to the beta mediated effect of the sympathetic system. Then what are these beta mediated effects? We know that there are three type of receptors, that are beta 1, beta 2 and beta 3. Coming to beta 1, it mainly stimulates our cardiac function, and also it stimulates renin release. So beta 1, cardiac stimulation and renin release. Coming to beta 2, a lot of functions like glycogenolysis, skeletal muscle contraction, increase aqueous humor secretion, and then K plus uptake and smooth muscle relaxation. Note that the skeletal muscle is contracting and smooth muscle relaxing. Now coming to beta 3, mainly it helps in lipolysis. So beta 1, cardiac stimulation and renin release; beta 2, glycogenolysis, muscle contraction, smooth muscle relaxation, aqueous humor and K plus uptake, and beta 3, lipolysis. Now that we got an idea, let us move on to the main questions. So one of the most important is the classification. We have two types of classification. In the first form, we are dividing the beta adrenergic blockers as non-selective and selective type of blockers. That is, one blocking both beta 1 and beta 2 and the other only beta 1. And since we know that beta 1 is mainly stimulating cardiac functions, it is also known as cardioselective type of beta blockers. So mainly there are metoprolol, atenolol and acebutolol. Metoprolol, atenolol and acebutolol. Now the non-selective is again divided into three, that is, one without having an intrinsic sympathomimetic activity and one with that kind of activity, and also some group of drugs having alpha blocking property also. Now let us study some example for each of this group. Coming to without ISA, we have the propranolol, which is the most common drug that we identify as a beta blocker, and then it also have sotalol. Coming to with ISA, we have pindolol, and with alpha blocking property, we have labetalol and carvedilol. Now note that all these beta blockers are having lol at the end. So we can easily identify a beta blocker as one that ends in LOL. So once again, we have the beta blockers divided as non-selective and cardioselective. The cardioselective, we have met at and acebutolol, and then without ISA, which include propranolol, with ISA pindolol, and with alpha blocking property. Now the second type of classification is based on generation. So we have three generations of beta blockers. Now it is easy to study this if you learn the first classification. So let us see how. So most of the drugs coming under the first generation are actually included in the with and without intrinsic sympathomimetic activity. So they include the propranolol, sotalol and also pindolol. So both the classes come under the first generation. Now in the second generation, we have the drugs that are classified under the cardioselective type of drugs. Now we have learned some of them. They are metoprolol, atenolol and acebutolol. Now coming to the third generation. The third generation include drugs having alpha blocking properties. So which are they? They include labetalol and carvedilol. Note that this relation is not exactly same for all the drugs, but it helps us to study easily. Moving on to the next important question, that is the uses. To make it simple, I have divided the uses as those involving the cardiovascular system, and then the non-cardiovascular system uses. So beta blockers are widely used in heart related disease like angina, myocardial infarction, hypertension, cardiac arrhythmias, congestive cardiac failure, and then dissecting aortic aneurysm. We will check about the non-serious uses later, but before that, we should understand why the beta blockers is widely used in serious cases. So let us understand what are the serious effects of beta blockers. So in a sentence, we can say that these beta blockers depresses all or maybe most of the cardiac properties. Beta blockers depresses all or most of the cardiac properties. So what all they can depress? They can decrease the heart rate, decrease the myocardial contractility, and because of this they decrease the cardiac output, and they also decreases the oxygen requirement by the heart. So once again, heart rate, contractility, cardiac output and oxygen requirement. In addition to this, they decreases the impulses from the SA and AV node, that decreases the conductivity and also decreases the automaticity of ectopic foci. So overall, beta blockers depresses most of the cardiac properties, and that is why they are used in all of these serious cases. Now coming to the non-serious uses of the beta blockers. Now in this list, first comes glaucoma. So why glaucoma? Because we know that beta blockers can decrease aqueous humor production. So how do we know that? Because we have learned that beta 2 function is to increase aqueous humor. So beta blockers obviously decreases it. So we can use temolol or betaxolol for this case. And next we can use it as a migraine prophylaxis. The reason for this is not yet known. And then beta blockers are used in a lot of diseases like pheochromocytoma, hyperthyroidism, and then acute anxiety attacks in alcohol withdrawal cases, and also in essential tremor. Pheochromocytoma, hyperthyroidism, anxiety attacks, alcohol withdrawal, and essential tremor. So why are they used? Because in many of these cases there will be tachycardia, palpitation, tremors, and all of this can be treated. They can be treated symptomatically using beta blockers. So once again, non-serious uses: glaucoma, migraine prophylaxis, pheochromocytoma, hyperthyroidism, anxiety, alcohol withdrawal, and essential tremor. So do a quick reminder of the uses, the serious and non-serious uses, and that the beta blockers depresses the serious properties and all the other non-serious uses. Okay, now coming to the next question. We have the adverse effects and contraindications. So the first adverse effect is that it can accentuate myocardial insufficiency. So why is this? This is because we have said that the beta blockers depresses all cardiac function, and similarly it can cause bradycardia because again it decreases the heart rate. Now beta blockers are contraindicated in cases of COPD and asthma. So why is this? Because we know that the beta receptors can cause smooth muscle relaxation. So beta blockers increases the smooth muscle contraction. Thus in such cases it causes bronchial smooth muscle contraction, which can increase the COPD and asthma. Now fourth, In diabetic patients, beta blockers can increase or prolong the recovery from hypoglycemia. So, why is this? We have seen that the beta receptors, the beta 2 receptor help in glycogenolysis. So, beta blockers decrease glycogenolysis and increases the time of hypoglycemia. Now, fifth is that it is contraindicated in variant angina because when the beta mediated relaxation is lost, the alpha mediated coronary constriction overpowers it and causes variant angina. Coming next, it is contraindicated in partial or complete heart block. Partial or complete heart block. Next is in the case of withdrawal. So, what happens when beta blockers are suddenly withdrawn from a patient? So, it can cause angina or MI. This is because of the supersensitivity of the receptors. So that's all. So once again, it can accentuate myocardial insufficiency and bradycardia. It is contraindicated in COPD, asthma, and in diabetics. It prolongs hypoglycemia. Contraindicated in angina, heart blocks, and supersensitivity. So once again, recap from the beginning. We have learned what is it and all the functions of the three receptors beta 1, beta 2, beta 3. In classification, we learned about two types of classification, one based on selectivity, and we know that all the drugs end in LOL, and then the other type of classification based on generation, the first, second, and third, and we learned about propranolol, which is the common type of drugs we talk about. And then about the uses, we divided it as serious and non-serious cases. And we know it is widely used in serious cases because it depresses all cardiac properties. And then the non-serious uses like glaucoma, migraine prophylaxis, and all that include symptoms of palpitation, tremors, and so on. And then the contraindications, as in case of myocardial insufficiency and in COPD, asthma, in diabetics, heart blocks, and then the withdrawal which is seen in beta blockers.